Doctor, you reviewed the films of August the 25th, the CT brain films of Mrs. Roberts?
Yes.
Okay. Did you see a clot on those films?
Yes, there's evidence of a clot.
Okay. And that clot, in your opinion, was it emboli? An emboli?
Yes, embolic phenomena that caused the clot in the left middle cerebral artery.
And I think we mentioned earlier that blood clot is equal to emboli, is that right?
Yes, I'm sorry, they're one and the same, yes.
Now, an IVC filter, is that going to stop all size of clots coming from the lower leg?
No, it doesn't stop very small clots from going to the brain, for instance.
Will it stop very small clots from going to the lungs?
No.
Can a catastrophic stroke, the type suffered by Mrs. Roberts, be caused by a small emboli?
Absolutely. I mean, what's one of the interesting things about stroke is it's not necessarily the size of the stroke, meaning some people can have a very small area of the brain affected from not enough blood flow and have an absolutely devastating stroke. And, you know, what it has to do is location. In New York, I guess everywhere, they say location, 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 right? The importance of where things are. So in the brain, there are areas that are very compact with a lot of different functions. So if you have a stroke in a very small area of that brain, you might have devastating complications. Versus other places in the brain maybe don't have as eloquent areas, meaning areas that you would necessarily even notice where you had a stroke. And so having a large stroke in that area, you might have no symptoms at all. In fact, some people have silent strokes, meaning that they have a stroke and they don't know it, and we only find out when we take a picture of their brain. So in answer to your question, the size of the clot certainly has something to do with it, but it is the location where the interruption of blood flow that determines the severity of the deficits as well as the size of the stroke.
So can a clot even as small as 2 millimeters cause a catastrophic stroke?
Certainly, yes.
And small emboli, can they also cause what you deem silent strokes?
Absolutely.
And what does silent stroke mean?
A silent stroke means, again, that someone has an interruption of blood flow to the brain that causes an injury, permanent injury to the brain. So stroke, I don't know if I mentioned it before, but a stroke means that that part of the brain's been permanently injured. The one problem with the brain is it doesn't grow back, right? Like on my skin, your skin goes back, you injure the brain, it doesn't. So a stroke means a permanent injury to the brain. But depending on the location, you obviously have different symptoms in relation to that. So if, I'm sorry, correct me, your point was?
Silent stroke.
Oh, silent stroke. Yeah, so people can have injury to different parts of the brain but not necessarily have symptoms from it. So it's not unusual. As I told you, I see patients in the outpatient that a doctor will send me a patient that he did a picture, a scan of the person's brain and found out that they had a stroke. And he went to the patient and said, "When did you have your stroke?" And they said, "I never had a stroke." So it's not that they're not telling us the truth. It's that they don't have symptoms. But it is still something to look at and decide, because why did they have any interruption of blood flow to the brain? Even though it was silent, even though they had no symptoms, that's still significant and something that you need to find out. Why did they have a stroke? Because maybe they can have another one in the future. So that's what a silent stroke is, or silent infarct. Infarct is another word for stroke.
And can tiny emboli cause silent stroke?
Absolutely.
Are you familiar with TIA being referred to as a warning stroke?
I've heard that some people say that, yes.
Yes, ma'am. And I'm wondering, since Dr. Moore was considering strongly TIA on August the 23rd as the culprit for Mrs. Roberts' presentation, should he have expected or known this left middle cerebral artery stroke was coming on August 25th?
Well, you know, to be specific, TIA stands for transient ischemic attack, which we've discussed before, so brief interruption of blood flow to the brain during a certain event causing symptoms, but not any permanent injury to the brain. And I think what you're referring to is TIAs are felt to be warning signs, right? I told you there should be no interruption of blood flow to the brain. So if someone has a TIA, even though they don't have any permanent symptoms, you're still concerned, because why do they have any interruption of blood flow to the brain? Could that then lead to a stroke later? So TIAs are concerning. TIAs are considered something that needs to be evaluated right away. But based on the fact that he thought she had a TIA in this clinical setting, he put her on the appropriate therapy to try to reduce the risk of subsequent events, which was the anticoagulation, the IV heparin.
Now, doctor, in your medical career as a stroke neurologist, how many times have you ordered an IVC filter to prevent stroke from paradoxical embolism?
Never.
Let me ask you, doctor, you touched a little bit on a bubble study test. Does a bubble study test rule out clots going to the brain?
Absolutely not. It's looking for a structural abnormality in the heart, but it doesn't mean that they were embolism.
Is there a test that a doctor can order that will absolutely rule out blood clots going to the brain?
You sort of trailed off a little. I didn't hear what you said.
Is there a test that exists that's available to neurologists to order that will tell them absolutely there were no blood clots going to the brain?
Oh, absolutely not, no.